Yeah, that should start now.
Brilliant. Thanks, Neil. Sorry, Fiona, I wasn't quite sure who pressed the magic button on that one.
Okay.
So let's do the formal bit. Welcome everyone to the meeting of the East Lothian IJB on the 25th of September 2025. This meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act. Data collection as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention. The webcast of this meeting will be publicly available on the website for up to 5 years. Okay, so that's the formal bit done. Fiona, do you want to do the roll call?
Yes, thank you. We have apologies today from Councillor Allen, Councillor Finlay, Jonathan Blaisby, Maureen Allen and Liam Kerr. And I'll now take a roll call of attendees. Shimeen Akhtar.
Present.
Carol McFarlane.
Present.
Patricia Cantley.
Present.
Andrew Cogan.
I'm present.
Elizabeth Gordon.
Present.
Thank you. David Binney. Darren Bradley. Lindsay Byrne.
Present.
Sarah Gosner.
Present.
John Hardman. David Hood. Kalonde Kathangeli.
Present. Thank you.
Thank you. Claire MacDonald. Claire McIntosh.
Present.
Thank you. Mike Porteous.
Present.
And Fiona Wilson.
Present.
Thank you, Fiona. We are quota and we're able to continue with our business. Can I ask if any members have any declarations of interest on any item? No? Okay. Last announcement before we begin is that item 7 on the agenda, which is the Care at Home Strategic Direction Report, will be brought forward and will be heard after item 3. And that's to allow the officer concerned to attend another meeting later on this afternoon. So we're now ready to do the business, Chair.
Great, thank you, Fiona. And can I just formally welcome Lawrence as Chief Executive of East Lothian Council. One of my items on my chair's report was to say that we had a partnership meeting after the last meeting and before this, and we invited Lawrence to attend this meeting and or a meeting of the IJB, and thankfully Lawrence was able to attend this one. So you are very, very welcome, and please contribute as you see fit. But it's good to have you with us today. So very welcome.
Thank you, Andrew. Great to be here.
Okay, so we'll start the formal business. We're going to look at the minutes of the meeting that we had on the 26th of June. It seems a little while back, doesn't it, now with summer? So we're back into full swing now. So we have some action log that we'll come on to next, but let's quickly go through the minutes and I'll take it very briefly page by page just to check people are okay. So on page 1, page 2, page 3, page 4, page 5, page 6, page 7, page 8, and page 9. I see no hands at the moment, so I think we can accept them as a true and accurate record. Oh, Tricia.
I think, yeah, on page 8, it said something about Dr. Cantley asked why an integrated impact assessment had not been carried out. Sorry, no, it's fine. Ignore me. It's fine.
Are you sure, Trish?
Yeah, I'm sure. I think I misread a not.
Oh,
it's okay.
Right.
It's fine.
Okay. So thanks for that. We take that as a record. We then have some action logs. So 1 and 3 are essentially the same actions. They're around the various Scottish Government papers that have been received earlier on in the year and how we as an IJB respond to them. Just for people's noting, and you will have read the strategic plan, quite a number of those have been included as part of the narrative to the strategic plan, and people have had an opportunity to read those documents and will get an opportunity to reflect on those further as we continue the development of our own strategic plan. So unless there is demand for a specific development session on that, I think we've given enough opportunity to that. A number of us are at an NHS Lothian board development session next week where the NHS elements of that will be part of the conversation. And if there is anything pertinent that comes out of that, I think we'll keep the flexibility to include that to come back to the IJB. But unless I'm hearing otherwise, we've had the opportunity, the documents are there, we will get opportunities to reflect on them as part of the development of the strategic plan. So I'm happy to close those actions down unless there's any strong views otherwise. I'm seeing no objection to that, so thank you for that. Number 2 there is a summary of the Clinical and Care Governance Committee annual report to be presented to the IJB. IJB officers presented that report to the NHS Lothian Healthcare Governance Committee on Tuesday, and it was approved. And I think then, Sarah, that can go as a note to this meeting. We've done that with other minutes of meetings, so at an appropriate point, let's include these for information to members. So as members see the governance processes that are processed through the NHS Lothian Healthcare Governance Committee. The other 3 items on the action list, I think we've got query, are they completed? I've been advised by colleagues that we can close all of those down as either completed or we have a plan in place for them at future events and future development sessions. So I'm content to close them down if everyone's happy with that. Again, I see no hands, so I'll take that as support for that. My chair's report is going to be very brief. Shameen.
Thank you, Andrew. It was just on matters arising on page 2. I'm quite keen that we still keep an eye on any additional resources that may be coming our way, because a lot of the documents that are coming through now are talking about a shift in the shift from acute to community, shift from hospital to community, and I'm quite keen that we still keep that on the agenda to keep an eye on that. And I know that staff are under incredible pressure, and through our papers that are here today, it's dotted in there that lack of resource. I'm keen that we keep an eye on that, and that if there's any resources coming our way, that we ensure that East Lothian receive them.
Completely agree, and I think both Mike and Fiona committed to that at the last meeting, and I know Mike will pick any of that up in future finance reports, but it's wise to remind us of that, Shamim, so thank you for that. Any other matters arising or issues to do with the minutes and the action log? I'm still seeing no hands, so I'll move on to a very brief chair's report. I've been on holiday a fair bit and I missed a number of there was only one IJB network meeting that I usually feed back on. It was around digital and housing. Shamim, I don't know if you got a chance to attend it.
Yeah, I did.
Do you want to give
really,
it 2 minutes? Was there anything there helpful to feed back on?
Yeah, I'm happy to share the presentations and a recording of the call, and it was really helpful. Scottish Federation of Housing Association came along and talked about tech and housing, and they had some really some great examples with Build Housing Association, where the levels of admissions to A&E and hospital had reduced by around 68% and 73% with housing support for individuals. So some really powerful examples, and those were examples from IJB. So happy to share that.
That would be great, Shameen. Thanks for that. The other item I briefly alluded to before, we had a partners meeting, which is IJB with NHS Lothian and East Lothian Council. I think that was one of Lawrence's first meetings with the IJB. That, I think, cemented the ongoing good partnership working between the organisations, and Lawrence's attendance here was part of that continuing process. There was a development session on the 28th of August. That's been duly reported, and I couldn't attend that, but I believe it was very successful, and lots of thanks have been given to the carers and their representatives who presented to that. So that's very positive. And my final one is that we have another development session on Wednesday. I think that's in people's diary. That is an organisational development led session around how we work together effectively as a team in what are likely to be challenging times ahead. So an agenda for that, I think, went out yesterday, Neil, and I hope we get as good attendance for that one as we had for our other development sessions. So that's the end of my very brief chair's report. Let's move on to then business. So we're going to deal with item 7 first, and Fiona or Laura to introduce it, but I think Jamie's going to take us through the paper.
Yep, it's the Care at Home, a new strategic direction report, and yes, Jamie Forster's here.
Thank you very much, Andrew. Thank you very much, everybody. Good afternoon. So yeah, I'm here to talk to the Care at Home, a new strategic direction. So this report fundamentally sets out a new strategic direction for Care at Home, 2025 to 2030. Predominantly, this should improve delivery of community and funded services, support system change, and ultimately enhance outcomes for individuals and unpaid carers. The item for attention is the Care at Home Strategy, paper 1, rather. Apologies. Bit of background. The work so far under the Care at Home Delivery Group, a system-wide approach has been taken to explore opportunities for change, prevention and early intervention from community and third sector partners, alongside operational developments, has demonstrated efficiencies and improved outcomes for individuals, carers, and system flow. Key enablers identified for the strategy are care coordination of community resources at those early intervention stages as tested by Community First. Self-management is a key part of this and something that is widely promoted across NHS partner organisations. Robust statutory processes, asset-based conversations informing holistic support planning, refining coordination when responding to changing need. It's very much a multidisciplinary team approach. Clustering of care in localities, in small towns, villages, communities, coordinating capacity across all provision. So that's across all care provision and associated system supports. An implementation plan is required to deliver the strategy. Partly population complexity of care needs is increasing. Supported by innovative change, there is a requirement to spend to save for long-term investment. Key priority will be to assess the level of investment, taking into account population changes and current unmet need. This will include investment in a care coordination model, including early intervention and preventative community-level resource, such as Community First, through our partner Volunteer Centre East Lothian, and utilising their live population data reporting to further inform service-wide responses to locality need. The projected need also for care at home services across all localities, and the recommended commissioning approach for care at home, and the funding required to support the delivery of care. We asked the IJB to approve the care at home strategy, which is underpinned by external consultancy, engagement, the locality project conducted at tail end of 2024, partner knowledge and experiences. Also asked the IJB to note that the SPG has agreed to the development of an implementation plan, which has been led by general managers. To take any questions, thank you.
Brilliant, Jamie, thank you. Just for members' notice, this has been through the strategic planning group at the last meeting, and it's been subject to a lot of consultation, but this is the paper that's for formal approval by the IJB. So I shall open it up to questions and comments from colleagues. Shameen?
Yeah, thank you. Thanks, Jamie, for presenting the paper. What I wanted to ask was, it was a 12-week pilot at the end of 2024, and I suppose as IJB has to make a decision about its finances, are you able to outline what the impact this piece of work had on care at home, on the care at home budget? And also, were you able to share any feedback from the people who use the service and also their carers? Because we talk about the vital role that unpaid carers play and need particular attention to ensure that they're able to continue to provide support and care. So I just wonder if you could give us any feedback from their perspective of what difference that made to them and on the service.
Certainly, probably the best use of time is to give you a case example that came through Community First. Qualitative feedback, a individual delayed discharge and had been in hospital for many months, ready to be discharged home, on the waiting list for care at home. A different conversation was able to take place, and community supports identified to facilitate a timely discharge. Also, other case examples of carers being signposted to other resources, again, simply by having a slightly different conversation than our more traditional sort of assessment processes. Financially, it was only a 12-week test change project, but within that time, there were projected cost savings based on earlier discharge, alternatives to traditional care at home. I think the main positives that were identified were that an earlier intervention and prevention model with both carers and the individuals requiring support enabled a better conversation and alternatives to be identified over or to complement funded care at home services.
Thank you. Would you be able to comment on, did it have an impact on hospital admissions for the residents in East Lothian?
So it was running alongside the same time where we had unscheduled care payments also happening at the time. So it was able to complement other projects happening at the same time. I know Laura's got her hand up. We'll probably be able to come in to offer some more input on that.
Right, yeah, sorry, I think that's right, Jamie. And I think it's just remembering that it was such a short period of time, really. So it's hard for us to really extrapolate, okay, did this have a direct impact? I think the key messages were that, you know, they had those impacts, but we need to sort of look forward then, okay, what was the position of these people 3 months later? And being able to carry on some of those supports that went in. So yeah, it's hard to say. It would be hard to say this happened and therefore this person didn't go into hospital in just such a short period of time. But it's that early intervention stuff that was really key and really showing some good messages or good interactions that were happening, and that key working with social workers and other assessors to try and get there earlier and prevent that admission. But we couldn't directly attribute it for just a 12-week project.
Jermaine, do you want to come back on that one briefly?
Yeah, no, that's fine. Do you feel then there's a little bit more work that needs to be done then to be able to get a real idea of what the interventions are needed? So when you put it, so that the IJB will know actually this is what we require investment to be placed into to support this work, whether it be community intervention or more support for carers, because we're asking them to continue caring.
Yeah, so I think the report is quite good at sort of outlining some of those really positive interactions that happened, and I think that's sort of the recommendations that what we were looking to do now is take that forward, and how does that become business as usual for us? Because it was clear from the report that the interventions that happened were positive, they made an impact on those 12 weeks. And what we need to do is make sure that that becomes business as usual. And we've got work to do operationally. How do we implement this? So I think the report's quite good, giving that level of detail. And yet, pleased if the IJB can support the recommendations that are made from that.
Isabel, do you want to comment on that point, or is a separate one?
Yep, no, what I'd like to say, sorry, I've got a bit of a cold, so I'm a bit nasally. But yeah, the point, one of the points I want to make is something else that we need to do is to work with the community in terms of the expectations, because there is an expectation. You'll come into social work, you'll get all this care, but we just don't have the funding to be able to do that anymore. So we have to do a piece. We need to work with the community going forward in terms of the expectations and just getting that honesty out there about what we can and we can't do and how we're going to do it. So for me, that's a key piece of work that's not necessarily located in the strategy, but something that we need to do.
Thanks for that, Carol. Thank you for your patience. There was a trail of conversation there, so thank you for your patience. Over to you.
Just on the back of what Isabel said, I'm having lots of questions about the funding for the recruitment and retention of staff and how that's going to be managed.
Jamie, do you want to come back on that?
So funding, if I can clarify the question again, Carol, funding for staff.
Or where are the staff going to come from? Was that the question, Carol?
Yeah. Yes.
Okay, so I think firstly, it's that very earlier, I think, Shameen, you identified keeping an eye out, the IJB keeping an eye out on additional funding streams, because a lot of the reports that are coming through are identifying a sort of spend save measure. So I think, again, as Laura alluded to, once we have an implementation plan in place, the key messages within the strategy are about identifying, once we have a lot of other system measures in place and assured ourselves that we have actually nailed it all, we then are able to establish our exact levels of need. So whether that is in the preventative front end community-based services, or indeed in funded care at home, we know exactly what the level of need is, and then aspire to meet that level of need across the population, or across the East Lothian, across all localities through the delivery of these models.
Laura, did you want to add to that? Your hand was up and then down. And
yeah, just because I guess Jamie covered it. I think it is that important bit about knowing what our need is. We're trying to push away from care at home, so we have only got those who most need care at home receiving care at home, and looking at other forms of support earlier on, but also at a higher level. So yeah, it's just looking at all the demand. And I think you're right, Carol. As you know, recruitment is very difficult. We've kind of come to our max of how many care at home staff are in East Lothian. I don't think we're ever going to get above where we are now. So it's about using it better and more efficiently. And that's, yeah, as Jamie was saying, that's part of the project. But identifying our need, making sure we get the right care in the right place at the right time, and then using it as best we can.
Isabel?
Yeah, it's just to say that we have had additional funding. It was Fiona applied for that through the kind of Home First model. So we have put in additional support through the into care at home as a result of that. And that certainly, as started 2 years ago, the amount of hours that we're looking for that were short kind of has reduced by 2/3. Within that period of time, and that's partly because of the way that we're working on care at home in a range of different ways within across the services, and it's also to do with additional money that we put into home care that went through the hospital to home, wasn't it, Fiona?
Are you okay if I come in, Chair?
Yes,
Yeah.
please do.
Yeah, so I suppose just joining up the paper that Jamie has presented and the conversation. So I think this offers a great opportunity around, one, we need to start having a different conversation. We need to look at the wider resources that are available. And a piece of work we've done together as a team is actually some of the good work we do around kind of channeling the focus when people are in hospital. We've tried to come together as a team, well, what we do, but in directing it in a different way around actually the people in the community and the unmet need that's there. And there have been very positive conversations around actually what are some of the alternatives, where are the opportunities, and Jamie and wider colleagues have been part of that, because I suppose it's just going, we can't keep doing things the same way because of resources, workforce, all the stuff that we've rehearsed here time and time again, but also engaging people early on, and how do we shift to that prevention model that then supports the people who really need the care get it. And some of the work where we've had the investment in unscheduled care has allowed us to deliver different pathways that support people to really optimise where they're at, but also allow quicker access. So I'm hoping it's a very moving picture, but I'm hoping it joins up what Jamie has presented around actually this test of change and the opportunities, along with the statutory, what we have provided, and this kind of shift in collective movement of where we're going, all for the benefit of people of East Lothian, because we want to do the right thing by them.
Thank you, Fiona. That's a helpful summary. That, I think, that came across both in the paper and in the strategy. It's we can't continue to do things that we've already done because the staff aren't there, and the systems and processes need to reflect a changing world. And I think that comes across in the paper. So, but thank you for the summary. Any other comments, observations before we move to this, Shameen?
Yeah, just on reflection on this, that we'll be looking for more support from the local community. And so I think a collaborative approach with the connected community team would be another good way forward. And that the other thing I was just thinking around this was, we have a carer strategy, but does that mean we have to go back and look at that again? Should the additional resource or etc. be needed to support carers if we're asking them to do a bit more, to be taken into account when you come back? So you'll be coming back with an implementation plan and maybe examples of case studies of what impact it's had and what financial benefits the new model is going to create.
I'm sure officers will confirm that's the case. Fiona, nod, and yep. Laura?
Yes. We will continue to keep the IJB updated on how things are going. Obviously, the two carers very much integrated into this, and we have our strategy there, and that's still aligned. And yeah, it's about the whole system, isn't it? We can't just look at one area, and we've also got our eyes on the bigger picture. So yeah, and we can come back, and I think for me, it's about that whole system change that we're looking at from the very beginning. It's not just our endpoint care at home. So we'll certainly come back to the IJB. You'll hear the initiatives that are going forward and how things are progressing and how things are working with the community. And note your point about connected communities, and we do need to improve our work. And yeah, what's the connected communities offer? How do we work with our communities as a whole?
Great, thank you for that. I'm seeing no further hands, so there are two recommendations. The one is to approve the care at home strategy and to note the agreement to the development of an implementation plan led by the general managers. I'm seeing no dissension. Are members content? I'm seeing nods and support, so thank you for that, colleagues. Then we accept those two recommendations. Thank you. We now move back to the agenda, so we're back to agenda item 4 on my paper, which is 4 and 5 will be Claire leading on these, which the first one is our annual performance report for 24-25. I think straight on to Claire.
Okay, thanks, Chair. So the purpose of this report is to present a draft version of the IJB annual performance report for the year 2024-25, so the most recent financial year. Hopefully today we'll be able to give IJB members an opportunity to feedback or comment on the content of the performance report. It's quite a lengthy report, so we're not going to go through it in any detail at this meeting, but there will be an opportunity later on to feedback. And then subject to any amendments or feedback that leads to changes, for the IJB to approve it prior to it being published online and disseminated wider. So just to give you a very brief background to the development of the annual performance report, this is a legislative requirement. IJB is required to prepare and publish an annual performance report each year. This report is based on information gathered from services across the partnership, so thank you to colleagues for all the contributions. Some of the content will be familiar to you as IJB members because you've had reports on these various topics throughout the year. I suppose in general, it's about describing progress in delivering the IJB strategic objectives that are contained in its strategic plan. It includes a narrative on key service developments and activity throughout the year, along with some examples illustrating the outcomes that our services deliver to individuals. Importantly, I think it also highlights some of the challenges faced by services, including in relation to the financial context that we're working within, and there's a section towards the end on financial performance. Just to draw your attention to the data element of the report, so towards the start of the report, we include data on the national integration indicators that are set by the Scottish Government. Again, this is a requirement from the statutory guidance that each IJB publishes these each year. So they're included from pages 15 to 17 of the report. We've presented the information so readers can see performance in the most recent financial year compared to previous years, as well as to compare performance to the national average, the Scottish average. There's a short narrative for each of the indicator, and there's a reference to where people can go to later in the narrative to read about activities that are related to delivery of that particular indicator. So just very briefly, again, I'm not going into much detail, but just as an overview of performance against the national indicators, East Lothian's performance can again be seen to be overwhelmingly positive. So our position improved or remained around the same for 7 out of 10 of the indicators, despite obviously the challenging context that services are operating within. We're also ahead of the Scottish average in terms of performance against 8 out of 10 indicators, in line with a further 1 indicator and only slightly below for the remaining indicator. So hoping that people have had a chance to look in the report in more detail in advance, and would invite any questions, with the caveat that if we're very service specific, maybe colleagues on the call who can respond to these.
Thanks, Claire. On that note, let's open it up to any comments, questions, observations. Elizabeth first.
Thank you. Thanks for that report, Claire. I would just say I thought that the case studies worked really well, and just wanted to say well done to the teams involved in that work, and just really good to see how it works in practice, because I think when we as board members read about initiatives and so on, it's hard to imagine how it all works together in practice. So I thought that was really, really helpful. So thanks for that.
Thanks, Elizabeth. Shameen?
Yeah, no, thanks very much, Claire, for pulling all of this together. There's a huge amount in here, and I'll take some of it offline with you. But it was just what your plans would be because it's really important for the public to be aware of some of the areas of work in here and the success stories. And so, for example, the level of appointments, for example, at the community hospital have now increased to was it 57,000 appointments. Do you have any plans to pick out really kind of the key things that would resonate with the public to be able to get across? These are the kind of some of the things that the Health and Social Care Partnership have been working on that have made a difference to people in the local community.
Yeah, so what we generally do is our colleague Jen Jarvis will do a press release, and as we publish the annual performance report, it goes onto the website, and Jen will do that press release and pick out some key highlights. But also to say throughout the year, there's a lot of comms work goes on. So there's that sort of drip throughout the year, which is performance reporting. Some of the communication that goes out is about information for members of the public on services and how to access assessment and so on. But a lot of it is on performance and to highlighting areas that we're doing well, good news stories and so on. So I think this is just part of it, the annual performance report, and it's a retrospective going back to the last financial year. So I think it's seen it as part of our overall communication effort, which I think we do really well. There's a lot of, even our use of social media, I think, is increasingly helpful with sort of spreading the word about performance.
Jen, do you want to add anything to that?
Only just to reiterate what Claire has said is that yes, we will do that. Pending approval of the actual report itself from the IJB, then I can kind of develop up the press release and highlight some of those key points and put them out as to the key stats.
Brilliant, thank you. Fiona?
Sorry. Yeah, just reflecting that bit around comms, and I think it is something we do well and have had it reflected back to us. We regularly meet with the care inspectorate, and the person who we meet with says, I feel I know what goes on in East Lothian because of what is coming out. It is so, her words, impressive to see that, because you don't get that everywhere. So that in some ways assured me. I know it's not necessarily somebody in East Lothian, but I thought that was quite helpful, getting that feedback unprompted. So Jen, exactly as you keep doing, we're trying to put stuff out into the public. Again, we just need to keep at it. We absolutely need to keep at it because it is important stuff.
Thanks, Fiona. Elizabeth?
Thanks. Yeah, just following on from that, just wondering, Fiona, obviously it sounds really fantastic, the initiatives that have led to the sort of upskilling of the staff at the community hospital to be able to do all these additional procedures and so on, and then stop very ill people having to travel into Edinburgh, which I think is really good. Do you think that, I know we're talking about past performance here, but is there much more scope to continue to expand with initiatives like that? Thanks.
So I'll look to Sarah as well, but yes, I would say so, and it is the direction, isn't it, nationally, of what else can we move out. But yeah, I think there's opportunities. I think the challenge for us just now is the workforce element of it and the specialist skill and the training. But Sarah, you maybe want to add to that better and more eloquently than me. We've definitely shown the art of the possible, and that's what we want to keep doing.
Go on, Sarah.
Thank you, Fiona. I thought they could do it better than you. But no, absolutely. I think, as you've indicated, the workforce could potentially be a challenge. We know around numbers, for example, nurses with a reduced working week, etc. But certainly our workforce is really keen to develop and look at that sort of innovative ways that we can enhance our services even further. And I think what we have to be really mindful of is if we enhance the sort of competencies for our nursing staff, it's how we maintain those. So it's making sure that we have a continued flow from that service to maintain our competencies. But it's certainly that we're and the team are really keen to take forward as we're able to, but also making sure that we maintain the services across the board. So actually, if we are moving staff to do more enhanced competencies, we need to make sure that we still have sufficient staff to provide the overall care for the patients.
Thanks, Sarah. My comment is on this is that sometimes you read how challenging the world is, and then you see a report like this that shows actually how well the HSCP is doing, and that isn't by accident, that's by design. And I think we just take moments like this to reflect and to say thank you to the staff. And I think on behalf of the IJB, we need to thank Fiona and the teams, and right down to operational level and all staff, because these things don't happen by accident. These high levels of performance are because of the way in which services are delivered. And it's quite humbling, isn't it, to see a report like that shows us as 8 out of 10 national indicators. We are well ahead of the curve, delivering services that are in some cases in the upper quadrant, which is fantastic for residents of East Lothian. So I think on behalf of the IJB, we should pass on our thanks to all the teams involved in this.
Yeah, it was just to echo what you were saying, Andrew. I think just that staff are on the call and that are working hard through social work, social care and health and the voluntary and community sector. And what you noticed in the tables of where there was collaborative work, whether it be Home First or multidisciplinary, we saw that our outcomes were getting like slightly better, and I also recognise that staff are working under extreme pressure. But there's real areas like Crookston Care Home I visited just recently, and the level of care and support they provide, the learning disabilities team, the resource coordinators, and we're seeing that impact in the locally in our local communities, and the levels of appointments at the community hospital and the day centre outreach work for people with dementia, the carer friendly campaign. So I think it's really important to keep highlighting some of those important areas in there, but at the same time recognise that staff are working under huge amounts of pressure at the same time, but everybody's trying to get the best outcome for our residents.
Thank you, Shamim. Let's close that down. That's I think what the recommendations are to review and to approve. I'm fully supportive of both of those recommendations, and I'm looking to colleagues. I see nods and thumbs up, so we accept those two recommendations. And thank you, Claire, for pulling that report together. Okay, and I think this leads nicely on to the next paper, which is around our new strategic plan, and which we enter that with a very solid performance base. So, but I won't steal Claire's thunder on that. I shall hand over again, Claire, to talk us through agenda item 5.
Thanks, Andrew. That was going to be my opener, but it's a nice segue
into. Sorry.
So yeah, okay, I'll say it again. So this report comes nicely after the performance report, that strong foundation, and this is looking ahead to the next 5 years in the IJB's strategic objectives and strategic plan. So we brought a report to the June meeting of the IJB, so the last meeting just before recess, and then we've been continuing our work on the review of the strategic plan over the summer. So just to kind of reverse back to the June report, in that report we presented a set of draft strategic objectives and delivery priorities to the IJB for discussion. It was agreed that we should take these and work them up further to form a consultation draft, which is what we've done over the summer, and it's now appended to this report. So the consultation draft includes some additional detail based on discussion over the summer, so not substantive changes to the objectives or the delivery priorities, but some more detail following largely discussions with some of our general managers and senior staff. So we've done a bit more work on them. We've added a section to the start, and this is information that we've been looking at to date that has informed our content, informed what we're proposing is the objectives. So there's a bit on the strategic context nationally, a bit on local context, and some of that really strong partnership work taking place at a local level. There's also a section on finance and a section on population data, and a link to the Joint Strategic Needs Assessment, which we're hoping to publish soon, which it contains more information on current population data and some projections on growth and so on. So 2 sections of the consultation draft, the contextual part, and then a section that has the strategic objectives and delivery priorities. So the IJB had a chance to review these back in June, so I won't go into any detail about them just now. Only other thing to say, so the next step, so now we have that consultation draft. We took it to SPG 2 weeks ago and agreed that we could start using it as a basis for a more formal consultation stage. So this will include, amongst other things, presenting the consultation draft to meetings with partners. So we've got it lined up to go to meetings of NHS and East Lothian Council CMT. It'll come to the partners meeting, which I think will provide a really good forum for discussion. It'll also go to SPPC on NHS side and to the NHS Lothian board before hopefully being ready to come to the IJB in December for final discussion and potentially approval. Alongside that more formal consultation, we'll also continue to do the more sort of engagement side of things with community stakeholders. So colleagues have been working on resources to try and make that engagement activity accessible. So there's an engagement pack, there's also some information online and an online survey. Communication's gone out to a vast list of our community stakeholders. So that went out at the start of the summer, and then more recently another reminder has been sent out that there's this opportunity for them to provide feedback. We've also started work on developing the initial annual delivery plan. So obviously that'll need to be based on the final version of the strategic plan, but we can start to work up some detail of the delivery activity that we're anticipating. Paragraph 3.8 includes timescales for the next stages, as I say, leading up to that presentation of a final draft of IJB in December.
Great, thank you, Claire. So let's open this up to any conversation and discussion here. There's been a fair amount of conversation around this already, but let's open it up here. So thoughts, colleagues? Elizabeth first.
Thanks. Thanks, Claire. I wasn't at the June meeting, so apologies if I am saying something now that would have perhaps been better in June. I understand the reason why we have explained so much about background and context, but there is a lot of information there. The explanation of the national context with 3 interconnected frameworks, and then talking about the Lothian Strategic Development Framework and the 6 pillars. I'm just wondering, do we need that much detail? Because I think if you're not immersed in strategic planning, to look at this as an outsider, it's a lot to take in. There's a lot of acronyms. I'm just wondering if this bit could be scaled back slightly. But that was just an observation. But other than that, I think it's looking really good, really good document, lots of really good stuff in there. Another question I had was, further down the line before it's published, will there be a foreword added with a sort of flavour of the whole thing? And the last question I had was, will there be scope for us as board members to attend the strategic planning group when the advanced draft is being considered? Because having experienced this process in Edinburgh IJB, I think that might be quite helpful for board members. Thanks.
I'll let you come back on those before I go to Shameen.
Thanks, Elizabeth. So I absolutely, the contextual part is chunky, and we were thinking, so there's potential to go straight into the strategic objectives and delivery priorities at the front and almost append the contextual stuff. In a way, it's showing our working. It's like, this is how we got to these, because we're reflecting the national strategic context, we're looking at our population data and so on. So yes, I think we could think about that. I think also ultimately once we get to a final draft, we will have a summary version as well. We've got that at the moment for the current strategic plan. It's a plan on the page, so it's got the objectives and the priorities as a sort of like a quick glance. So yeah, I definitely not too late to make that comment, and really useful, so I could give that some more thought. A forward sort of introduction, yes. And I've had this discussion with Fiona and David, and we spoke about kind of setting the mood for the strategic plan. That's something that doesn't, like in the current body of the draft, it doesn't really kind of set that mood in terms of the aspirations and so on. So I think that would be good, and it's something that we've definitely got in sight. So final one is the scope for board members to be involved in the SPG session in November. Yes, so we were considering running that as more of a development session, and by that point we'll be at a pretty advanced draft of the strategic plan. So it may be that that session is a bit more about thinking about the first annual delivery plan. So yes, all of these, I think yes and yes and yes.
Shameen chairs SPG, but I don't think either of us would have a problem with any further conversations taking place at any relevant meetings, Elizabeth. Yeah, the more engagement, particularly with voting members, that we get over the next few months, I think will be really helpful. Laura, was your point on that, or was it separate?
Yeah, sorry, Shameen, if you don't mind, I just come back. So I suppose it's just quickly on that chunky level of detail at the beginning, and I hear what Claire's saying. Andrew, I'm slightly laughing at you because I know you were at last meetings. Really want to make sure that we've covered this off. So there is a fine line. I think to remember, I think it's important that we have that level of detail just now. There will be that summary plan on a page, etc., that comes later. But there is something that is so important that we reflect. This is how we have come to this strategy. This is what we've consulted with. And I know it's lengthy. And I suppose we've discussed before the importance. Yes, we need everybody's views on this. But yeah, I think reflecting what Andrew and what we spoke about before, it is important that we note those documents and why we've got to this stage. But I appreciate it's a lot to take in. And then, yes, about the SPG, I think that's why we've started to invite SPG members into the IJB development sessions and vice versa, so we get that mix, because you're absolutely right, Elizabeth. We kind of forget that you're not there, and then we wonder why you're not understanding what we're talking about. So, yeah, definitely think that would be really helpful.
Thanks, Laura. Shameen?
Yeah, no, thanks, Claire. It was just to ask, there's quite a number of specific activities. If you could just talk us through of where the timescales and who will be responsible and targets, because that came out in audit and risk from our audit around setting targets for ourselves and being able to monitor progress.
Yeah, so that level of detail, Shameen, will be in the annual delivery plan. So as I said, we've started to kind of map out what that will look like, and we'll begin to add more detail. So that's about having conversations at service level about more specifics. And included in that, we'll need timescales, and we'll need progress measures and milestones and all these kind of things that you would have in an annual delivery plan. Obviously, because it's annual, we'll have one of these each year, and we'll review them 6 months and at the end of the year. So I think we also need to have a bit of a roadmap that says, okay, we're going to have these 5 annual delivery plans, but some big milestones over the 5 years will be this and this and this. So we're beginning to really map it out.
Okay, thank you.
Lawrence?
Thanks for permission, Chair. Just to kind of agree with Elizabeth a little bit, to the new reader, it's like, we want to consult with you, but we've given you every single piece of information we've ever had. It almost implicitly discourages you from commenting, I think, because there's so much of it. So I think you can keep all that information, but if you had a front bit that says this is why we've done it and this is what we really want from you, and had a really kind of engaging tone, I think that would be fine. But without it, it comes across as like quite a lot. So just to agree with Elizabeth on that. Thanks.
Thanks, Lawrence. Jen? You're muted, Jen.
Sorry about that. So just to kind of put your mind a little bit, if I possibly can. So what we've done with the surveys is the first one that we put out questions about the objectives and the delivery priorities specifically. The second one that we have done just most recently has focused on the objectives with links through to further information on like the priorities and the background information. So you get there's not as much full depth about the context that you have to wade through in the first instance. You can give an immediate response and hopefully do that in a faster, more efficient manner, so it's not taking up too much of people's time, but we do still get the quality feedback on it.
Is there being good responses to the public side of it? Because I know some of that is out there.
So far it has been limited to date, but we are hoping that this refresher that we've put out just more recently is going to be an opportunity for us to engage further, and there are more opportunities for us to do it. Our contact database for our communities is in excess of 300 people / organisations. So we are going out to them, and the engagement officer as well has got kind of more detailed activity planned with kind of specific groups as well to go out and reach them too.
Claire?
We've been working with colleagues in East Lothian Council who lead on community planning, because we're currently developing the local outcome improvement plan, and I've done some really extensive engagement and I've had quite a good reach for that. A lot of the feedback coming back through their engagement is in relation to health and more general well-being. So we've been looking at that feedback, and I guess the things that we're saying are not in scope because we're specific to health and social care partnership services. We're taking that feedback and reflecting on it for our purposes. So there's that little bit of kind of crossover, which is how it should be.
Thanks for that, Claire. Any final comments, observations? This Jermaine?
Yeah, no, thanks, Andrew. It's a shame Maureen's not here today. I just think it's really positive around the co-producer compact, because we've talked a lot about how we have a positive, meaningful engagement with the voluntary and community sector and moving forward, because as we move with our demographic growth, we won't be able to provide or deliver all of those services together. And I think that's a really positive. That might be something that Maureen's able to highlight to her members if we were looking for engagement there. So that's a really positive, which I didn't see in previous ones. So that's positive feedback.
Yeah, good point. Thanks, Shimeen. I'm seeing no further hands. This paper is just for noting, and I'm sure, Claire, you'll take reflection on all the conversation that we've had now as we go on to the next stages of this. We've still a few months to go, and we've still got much more engagement to do. But I think we note the good progress that has been made to date, and wish you and the teams and everyone well in bringing this to a conclusion. So thank you, Claire. Okay. We now move on to agenda item 6. I think I've seen Martin on the call. So this is to look at the MELDAP annual reporting survey for 24-25. I think it's straight to Martin then.
Good afternoon. Thank you very much, Chair. It's nice to be invited to come and speak to the IJB about our annual report. First to note that we're asking you to note the report which has already been submitted to the Scottish Government. And what I really want to do with the report is take you through some of the sections of it, particularly 3.4, 5, 6 and 7. And sort of give perhaps a slightly more commentary on each of those sections rather than go through the report itself. So if everyone's okay with that, I'll just do that. So section 3.5 on page 2, we highlight that we do an awful lot of work with the Rapid Action Drug Alerts and Response Network, which is across Scotland, and we receive reports from that network, and we disseminate that information and discuss that information if there's any local issues for us there, as well as receiving near fatal overdose data from NHS Lothian, which is an accumulation of accident emergency data and Scottish Ambulance Service data. And we look at that on a weekly basis, and if there's any notes of concern, then we have discussions with the substance use teams, both at the S Centre in Musselburgh, but also at number 11 in Dalkeith for Midlothian as well. In terms of some of the things that come out of that work, we've noted at 3.53 that the substance use services and third sector staff make it as easy as possible for people to use the Wedenos scheme, which is basically if someone chooses to ask for a sample of drugs to be tested, that can be sent away to Wedenos to be tested. The interesting thing, I think, from our perspective, is that's a Welsh resource that's available to us. And I know that in Scotland there's some discussion around about whether there needs to be further development of drug testing sites. I know that's currently in discussion in some of our bigger cities. But it's important when we're needing to think about the dynamic nature of drug use in particular, where, for example, someone might be thinking they're buying heroin. It might be heroin, or it could be heroin adulterated with other drugs, and the capacity to find out what the potential risk of harm of that becomes really quite important. At 3.54, we've got a protocol that allows the roles and responsibilities of an action group that's been agreed, and indeed we pull that group together where it's required, and coincidentally we've got one on Monday afternoon coming up. And we also have a MELDAP harm reduction group, and I'll highlight some of the bullet points here. We've introduced home drug testing strips linked into that comment around about assisting people to understand what is it they've bought illicitly and what potential risks they have in using that. We've doubled up naloxone kits. So again, we know with the new synthetic opioid drugs that are around on the streets, the nitazene drugs, then there is higher risk to people, and we issued quite a time ago now 2 kits of take-home naloxone rather than 1 kit, because these drugs tend to be far stronger, and indeed you might need more than 1 kit in order to bring someone round from an opiate overdose. We've introduced Accuvane machines in the 2 hubs in the SS Centre and also the one in Dalkeith. Now, Accuvane allows clinicians to be able to see veins and valves in people's arms, legs, places like that where they might be injecting, to be able to understand risks to the circulatory system, risks of wounds, that type of stuff. So that's a new innovation that we've introduced there as well. And we're introducing for stimulant users, so psychostimulants like cocaine, crack cocaine, for example, we're introducing a service around about health MOT, and that's just about trying to encourage people to come into service and look at their physical and mental well-being as well, but also looking to assist them where possible to come into treatment and support, because they're quite a challenging group to engage with. The next section, 3.6 in staff wellbeing, just to note there that as part of the medication-assisted treatment submission to Public Health Scotland, we had identified some work that's ongoing currently around about the wellbeing of staff. We think that's really, really important, because our frontline staff they're a very committed group of hardworking professionals, but they're working at the front edge of our service delivery, and they're dealing with minimising harm to with people all the time, and that has its own impacts on them as individuals and as professionals as well. So we've noted some of the things that we're looking at there. I think that's important to take into consideration, that work in terms of looking after the current workforce, but also thinking about future workforce needs as well, because obviously as people retire, as people move on, substance use services are quite a challenging area of work, and we need to keep having the throughput of staff coming into the area to do that very valuable work. Just at 3.7, just to highlight us reducing stigma. Stigma attached to people who use drugs and alcohol can be really quite significant. If you look at some of the media publications over the last number of years, there can be some really pejorative language used in describing people who use drugs in particular. And I think what we've got to remember here, and my apologies for those who've heard me say this before, but these are our mums, our dads, our sons, our daughters, our brothers, our neighbours, the people that we live beside and amongst, and we shouldn't be referring to them in pejorative terms. We wouldn't do so for people who have cardiac conditions, or who have had a stroke, or have had other health care issues. We certainly should not be doing that with people with issues around about their own drug and alcohol use. So do quite a lot of work around about that. To that end, it's 3.72. We've introduced some low threshold cafes in Trinette and Preston Pans with help with Connected Communities colleagues as well, and also the Ridge in Dunbar, and that augments cafe provisions in Musselburgh and also Haddington that we've had for a number of years. The idea behind low threshold cafes is that people can attend even if intoxicated and begin to gain some support there from both peer worker staff and other staff to assist them to enter into treatment and get the support that they need. Point out 3.75, the use of person's first language. I've made reference to that already, but I think it's an important thing to reiterate. Lastly, at 3.8, the issues around about prevention and early intervention. We spend quite a bit of money on children, young people and family services in East Lothian doing exactly that. We're looking to support children affected by the parental substance use and families themselves, and also young people affected by their or others' drug and alcohol use to arrest harm, minimise risk, help them develop their own future, and I suppose with the implicit understanding that we want to minimise the risk of them becoming long-term drug and alcohol users who then need services in the future. We want them to be healthy members of our community. So we've got services from Circle and Children's Services in the Council, as well as Midlothian Young People's Advisory Service, who run a counselling and drug and alcohol service in East Lothian high schools as well. So that's the bits of the paper, Chair, that I would like to highlight. But I suppose that I've also got with your agreement either now or after questions, got some asks of the IJB as well. So it's over to you whether you want me to deal with that now or answer questions and then deal with that.
So let's take a few questions first, and then I'll give you the floor at the end, Martin, to make your asks of the IJB.
Okay, thank you.
So we'll open it up to any comments or observations. The report's been submitted through to Scottish Government, but it's always good to have an opportunity whilst Martin's here to raise any issues. So over to you, colleagues. Shameen, is your hand trying to go up there? Is it?
Just hovering. Thanks, Andrew. Martin, thanks very much for your report. I know you've done a development session with us before. It might be good to come back and do that again, because I found it really, really helpful. And I'm glad you've said my asks to the IJB, because I was going to ask if you had any asks, so that's great. But one thing I did want to ask was around this is really, really important work. You know, you're right, there are neighbours and our friends, and the level of support we provide is really, really important. It was around the sustainability of the services, because I know we've talked about this before. If you have any idea what's going to be happening beyond the next session of funding, whether we've been given any indication or not, because what I do read in the report, a number of sections is around the barrier to some of the things. So barriers to residential rehabilitation is finance. The barriers to some of the MAT treatment standards are insufficient funds, etc. So it was more to ask if you'd had any idea around that, and also just Chair Andrew to say what we can do as the IJB to raise that as a really important issue, because in 2020 there were 4 people who passed away, in 2024 there's 21. So it does look we do need more resource to provide support to some of these really vulnerable families of complex needs.
Firstly, Shameen, issue around about funding has been raised with the Scottish Government directly and ministers at an alcohol drug partnership meeting that we had in June. They're acutely aware of the financial challenges that we would face and organisational challenges we would face, and it relates specifically to the drugs emission monies that were for this Parliament. So the Secretary for Health did reassure us that that was on their minds and it was a priority for them to be looking at. But at the same time, he did say that that there was the normal financial planning processes from the Scottish Government would have to be taking place before that. So the short answer is no, we haven't had any formal reassurance, but we have asked those pertinent questions. And I suppose in relation to that, in terms of the IJB, we may come back to you if we need any support to reiterate that position and argument back to the government, because obviously we need the current resource that we've got. But the other issue that we also have is that one of the things that we know is a protective factor against near fatal overdose and harm is sustaining people into service. Now, by logic, if you're encouraging people to stay in services, but then you're also encouraging people to come into service, by definition, the need is going to outstrip the resource, and that's what we're also highlighting as an issue, particularly in relation to the Audit Scotland report that was published in, I think it was October, November last year, that highlighted that the Scottish Government needed to think more about the support of people who have issues around about their alcohol use, and also that section I referred to around about prevention and early intervention as well. So that point's been made to the Scottish Government through the Audit Scotland report. And to be fair to Scottish Government colleagues, they're aware of that. However, we still haven't got any answers, if that helps you any.
Yeah, no, thank you, Martin. That's maybe something that we need to take up as an IJB and through our channels around that. Thank you.
I'm seeing no other hands. Martin, you gave us some asks there, and obviously we would support anything in terms of Scottish Government. So final word to yourself then. So
just a couple of asks, and it actually relates to some of the work that I mentioned from the report that was sent to the Scottish Government. So I'd mentioned that we were running a pilot drop-in clinic, actually at the S Centre in Musselburgh, for people with psychostimulant-related issues, and they sort of doing a health and wellbeing MOT. Now, as part of that work, we're going to be asking people what further could we do to develop support for people who use psychoactive substances like cocaine and crack cocaine, because they're a subtly different group of people than other groups using heroin or street benzodiazepines, for an example. So we're looking at what our offer might be in the future. So we're going to take the opportunity as we run that pilot to ask those questions of the people attending the service. But what we're going to do with that is we're going to feed that into some work that we're doing with services ourselves. But if as a result of that work we need to augment or redesign some of our services, we might need to come back to the IJB through the MELDAP strategic group to identify any challenges or changes or financial challenges in relation to that. So although I've not got a direct task about that, is to flag it as we're undertaking that bit of work and we need to make you aware of it. The next couple of bits are less financially onerous, but more about the things that I mentioned about stigma and relating to people's rights, I suppose. So two things to highlight. The National Collaborative, supported by Scottish Government, developed a Charter of Rights for people with drug and alcohol related issues, and those rights we've been asked to begin to implement. Now our services have been advised of that and are looking into that, and we check that out as we do quality improvement visits with our services as well. But just to make you aware of that, a paper was taken to our strategic group as well around about that area of work. And it's around about the right of access to treatment, for example. So I'm thinking about, I mentioned the low threshold cafes, recovery cafes that we've implemented. We've also implemented, as part of the medication assisted treatment standards, the introduction of Buvidal, which is another drug that's therapeutically used for people who have issues around about opiate use. And that introduces a further level of choice for folk. So we're ourselves and our services are already doing some of this stuff, but it's to make you aware of that. And if you're okay with it, I'll send you on a quick summary, a 2-page summary of the Charter of Rights for IJB members, if that's okay. And the last thing, again, I'll send you a link to, if you're okay with that, is that we take this around about language and stigma very, very seriously indeed. And there's actually been a piece of work developed through the Anti-Stigma Network, and it's called People First Language. And it's a very useful document about getting people away from using those pejorative terms I indicated earlier on, into recognising that these are our people in our communities, as I said earlier on. So if you're okay with that, I'll send you that. I suppose the last ask is one that IJB members might have heard me say before, which is that issues around about harms related to drug and alcohol are often linked to deprivation and poverty. So we just ask IJB members, when you're going about your business and your other officers of the council and partner organisations are going about their business, to remember that if there is any levers that can be pulled or pulled in order to support further actions on poverty and deprivation, that can by definition have a positive impact on this group as well, because it is an increasingly challenging issue. If you currently, if you live in a deprived area in Scotland, you're 15 times more likely to die a drugs misuse death than a better off area, and likewise I think it's 8 times for alcohol specific deaths. So poverty is a major issue around about this. So those are my asks. Any questions about my asks or challenges, please feel free.
I think we accept them. Claire?
Hi, thanks very much. It was really interesting to hear that report. I do a lot of work in this area with this group in hospital care, and just to reiterate that excess harms from the psychostimulant injections in terms of infection and vascular problems is massive within the hospital, and as you say, hugely difficult to help patients in the acute setting around that. So really interested in the bit of work you're doing when you're asking people what might help, and I'd really like to be linked in to find out more about that. That would be really helpful for me in my work. The other aspect is the stigma, which again in the hospital setting is absolutely huge for these patients. They often find a hospital admission intolerable because of very, very high levels of stigma and sometimes outright aggression from staff. We've done a detailed piece of work of sort of focused interviews around patients who've been through secondary care, and that might be of interest for your team, and I can certainly share that with you, but it's pretty grim reading, if I'm honest, and pretty stark. But a huge problem, and your comment around the language is really well made and really, really important. The other thing around poverty, because patients get so little benefit of an acute hospital admission with drug-related harm, other than if you require ITU or surgery, following that very sort of high intense input,
people self-discharge, they don't complete treatment, they will be readmitted frequently, people come to A&E frequently. So it's adding very little benefit to people's long-term health and acute hospital admission, often in drug-related harm. So we're really looking at ways to do alternative, and it's a bit like this home first or care at home that we've talked about already today, an alternative way of delivering hospital level care for patients with drug-induced harms such as infection. And I'm conscious of this sort of term proportionate universalism. We're putting a lot more into people with extreme deprivation and poverty in Edinburgh to try and give them a level of care that other patients will take for granted if they can withstand a hospital admission. So we're supplying transport, we're doing taxis, you know, so we're offering patients more in order that they will get the care that other people will take for granted without the same level. And so that concept of proportionate universalism, I think, is a really important one if people's health outcomes are going to be improved. And so I just wanted to make that point. With regards to your point you made, Martin, about poverty, I think it's crucial, and the levels of deprivation that people are living in is quite astounding. And then the last thing, I just wondered what your feeling was around whether you think, given that everyone over the age of 16 in Scotland can be trained in the Loxone administration very simply with a 10-minute online course and the Loxone delivered out to people. And I've trained my teenage son's friends, and none of them are medical, and they're all 17 and out and about. But young people out and about in cities, out at night, they are people who could be impactful. And are you happy in East Lothian that is really sort of disseminated enough throughout youth groups, throughout possibly even senior school levels, these kind of things? It's fairly straightforward to do and could be impactful. But thanks very much.
Okay.
Hold on for a second, Martin. I'll just bring Colonde in because there might be some similar issues from a public health perspective that Colonde wants to raise. So, Colonde.
Yeah, thank you. Really interesting paper, Martin. So I appreciate that and the points that you've raised. And some of them echo what Claire was saying just there. I think the point that you made around, you know, the underlying factors such as poverty is an important one that we must always remember when we think about this, you know, poverty and the other socioeconomic determinants that will impact on issues around substance misuse. And the other thing that you were saying in terms of stigma, again, you know, it's another one, whether it's perceived or real, can have a detrimental impact on health and well-being. So it was really just a question in terms of, I mean, I look forward to seeing the link that you're going to share, but it was a question in terms of thinking around the language, as you mentioned, but if media is a key part of that in terms of reinforcing some of these stereotypes, what's your thinking? Is the issue that we need to, is almost working at that community level to change some of that, those stereotypes, or is it, you know, using that media level as the kind of levers to start changing some of this? Because obviously amongst ourselves, we can be, you know, we can change how we do things, but that's not going to have the biggest impact in terms of society level. So yeah, I'm just quite interested. Obviously, I'm not seeing the links that you're going to share, but I just wanted to hear your thoughts in terms of where do we put the biggest effort in trying to change some of those stereotypes.
Martin, I'm going to let you come back briefly. I am beginning to get conscious of time and pressures, so there's a few things for observation there. So please come back.
Just briefly to Claire, yes, we will share any output from the work we get in terms of what people feedback from the psychostimulant pilot. Yes, it would be very helpful indeed if you could share some information, the information that you had mentioned, talking about accessibility of service provision. We do have primary care outreach nurses in surgeries in East Lothian, which is very, very helpful. We've got that sort of service there, and we also have harm reduction workers out and about in most of our deprived localities, and in East Lothian doing some of that work, including sort of wound care as well. And we also look to provide bus passes, which you can do if you're in treatment. And also we will pay for taxis when we're in a circumstance where someone's at serious risk of harm, or the other reasons why they need to be seen straight away. So just to let you know that we're doing some of that stuff that sort of you could describe as hospital at home stuff, but I would be very interested to see how we can develop that further. Very, very interested indeed, Claire. So it might be useful for us to have an off this table conversation about that. I think it would be very, very useful. And just in terms of the stigma thing, Kalundi, what we need to tackle at all levels. So we're talking about the language earlier. We also, through our low threshold cafes and also recovery festival that we funded in Dunbar and Haddington, are wanting to show a positive picture of people in recovery, so that the message gets out to the communities that if you help people get access to support and treatment, they can get on with their life and they can be in recovery. And those are directly aimed at one end with the low threshold cafes, getting people who are in crisis and at risk into support, and at the recovery service end, because we also have a recovery college as well, is also about encouraging people into recovery and encouraging that whole concept in communities that people get better. And those are all about challenging that stigma related stuff. Chair, I'm sorry for taking so long.
No, it's okay. There's some further communications and links been made, which is very positive on that. I'm going to give the last word to Shameen on this one.
To say thank you very much, Martin. Just things maybe I could leave with you. We could come back on. You're absolutely right to mention deprivation and poverty, and maybe as an IJB we need to familiarise ourselves with our partners' action plans on poverty and look at what our contribution and input to that is. And I hear a lot about trauma-informed practice and around the language and how we support people that are coming in to use our services. And I just wondered how we make sure that your experience, Martin, and yours, Claire, is fed into that when training's provided to staff.
Right.
Yeah, good point, Shameen. Thank you. Martin, thank you very much for that. And this is not ended by any stretch of the imagination with this report. It's continuing. I think the formal ask is just to note the submission, but the conversation has been very constructive and very positive. So thank you. We move on, colleagues, to agenda item 8. Mike, the audited annual accounts for 24-25.
Thank you, Chair. I'll keep this fairly brief. So the purpose of this report is to present the IJB's audited annual accounts for 2024-25 to the board and to seek approval for them to be published. There's a few recommendations in the paper, and then the paper sets out the requirements that the accounts have to meet in their preparation and formulation. And it confirms that an unqualified opinion was given by the auditors on our annual accounts, which is what we are always looking for. This was in part down to the timely provision of accurate financial figures and supporting information from colleagues in both the partner bodies, and I want to take this opportunity to thank them for all their support and help in pulling that information together. I also had a very good working relationship with the auditors. The audit was fairly smooth. They made one recommendation, which I have accepted, and I will work to deliver that as the year progresses. And just to finish up by saying, once the accounts have been approved by the IJB, they will be signed by the relevant officers and published on the websites. But I'm happy to take any questions if there are any. Thank you.
That's great, Mike. Thank you. And I think we had an audit and risk committee earlier on in the week as well. I'm sure these papers have been through that process as well. So
they have.
So any comments, thoughts, observations to Mike? Shameen?
You're on mute,
Thanks, Mike,
Siobhan.
for pulling this
Sorry.
together into partner organisations. But I'm still mindful of that at the end of the day, we're still in a financial risk, and that we need to make sure that we're doing everything we can to raise awareness of the positive work that IJB is doing to achieve the outcomes for both of our partners, to getting the best outcome for citizens. So I think that's really important as we move forward in a kind of really difficult financial environment.
Thank you.
I'm seeing no other hands, and I'm just trying to get to the actual recommendations, Mike, on the paper. So I think there are 3 to note and 1 to approve. Can I get a quick straw poll? I've seen plenty of nods and yeah, for this. So congratulations, Mike, and a clean bill of health from the auditors is always to be well accepted. So congratulations to you and team and colleagues for that. And I think we accept your 4 recommendations. And I think we have time in diaries for tomorrow to duly sign reports and things. So we'll get that up and all sorted and through the system.
Excellent. Thank you.
So thanks, Mike. We then move on to our final paper, which is again, Mike, a finance report for Q1.
Thank you, Chair. So this paper presents the IJB with the outcomes of the Q1 financial review. It provides a Q1 update on the delivery of our efficiency programme, and it sets out the IJB's reserves position at the start of the financial year, and it provides a brief update on the financial planning process that we are undertaking. So I think it's probably worth saying at this point in time, the first 3 months of the financial year are usually spent from a finance perspective, pulling all the information together for NHS Lothian, the council and IJB's annual accounts, and also uploading all the base budget information and the additional funding that we receive both from our partners and from the Scottish Government for 25-26. So there's a lot of work goes on in those first 3 months of the year behind the scenes and all of that. For the IJB, what this means is that we are taking account of all the additional funding that we've received. So the pay awards and employer national insurance increases that we got from for directly employed staff in both partner organisations, the non-pay uplift that we got from NHS Lothian, which primarily has gone into support the prescribing position, the policy funding that we received through the council for real living wage and free nursing and personal care that largely went into social care and commissioned services, and the additional funding that East Lothian Council provided for this financial year to meet the historical pressures and current pressures that we have. And that's primarily gone into the adult social care services and the learning disability services. So it's just to give you an idea of all the work that goes on behind the scenes in the first quarter. Table 1 on page 2 summarises the Q1 financial position following all that budget load and the first 3 months of spend. So we're reporting a small overspend in health in the first quarter, primarily within the set aside services, and that's offset by a very small underspend in the social care services. And as stated in the paper, the Q1 position provides a very early view of the financial picture, and it tends not to be a strong indication of how the year will pan out. So, for example, we've only got 1 month of actual prescribing information that we can rely on in that report. Another thing to note, and this links back to what Siobhan was saying earlier, we've also received about £13 million worth of additional allocations from the Scottish Government through the health sector, and we have to make sure that we've got all of that in the system correctly and aligned up with the services that it needs to be. So the Q1 forecast is an overspend of 155,000 at this point in time. If you look ahead to month 4, that was updated or can be updated just verbally in the position. The forecast is now an overspend of just 64,000. So you can see that how things start to move a little bit after Q1. And again, that will continue we'll get a more stabilised position as we go forward. So looking forward to putting the Q2 position to the IJB, which I think will give a better indication or a stronger indication of what our financial outlook is for this financial year. Well, the paper also provides an early indication of the delivery of efficiencies, and Table 2 is showing a Q1 under delivery of about 313,000, and that's primarily within the health services, with a very small under delivery within council services. Some of that relates to the phasing of targets and the actual delivery. So what I mean by that is if we phase the target to be delivered equally throughout the year, and the actual delivery is a little bit more varied from month to month, then we will see some over and under deliveries as we go through the year. But the forecast is the important one, and we're forecasting strong delivery for the full year. The paper also highlights there are still some financial risks and pressures that we need to be aware of that may impact on our delivery and our ability to achieve a break-even position as we get towards the year end. Pay award funding, I think the council still have to actually receive that funding from the Scottish Government, so it's all in the position and anticipated, but we just need to make sure that the actual amount is what we expect and is fully funds all the pay awards that have been made. The prescribing position, as I said earlier, we've only got limited actual information on the prescribing position at Q1, and as the year progresses, that will become more informative and a stronger indicator of where we're going. And it does actually look like the prescribing position could be a challenge going forward, but we'll bring more back on that at Q2. And the last thing to note in terms of pressures is just around the potential impact of inflationary costs on some of our commission services that we're still working through with them, and hoping that it won't be a significant impact on our position going forward. The last thing, or penultimate thing to talk about is, and the paper talks about, is an update on the opening reserves for the IJB. So Table 3 sets out the opening position on our earmarked reserves that are available to the IJB at the start of the year. The biggest one being the unscheduled care reserve that we're expecting to utilise as the year progresses. And the paper just ends with a brief indication of the work that's ongoing around the updating of the 5-year financial planning and our work to develop a longer term approach to our financial planning, particularly around the transformation change programmes. So there's a lot of work going on in the background on that. But happy to take any questions if there are any.
Thanks, Mike. Let's open it up to any questions, comments, observations. Firstly, Shameen.
Yeah, thank you. Thanks, Mike, for the paper. It's something that we talk quite a lot about is the set-aside pressures, and I just wondered if you're able to comment on kind of the progress being made around that, because you mentioned collaborative working across all 4 IJBs and NHS Lothian to address the set-aside pressures and deliver balanced outcome. I just wondered, we always useful to know where we sit with the set-aside and what level of kind of change or flexibilities in there to support us in East Lothian.
Well, the work continues both collaboratively and as an IJB ourselves to try and influence the set-aside position, both from an East Lothian perspective and from a collective perspective. The unscheduled care monies that we're investing is having an impact on some of those positions, some of those services within the front door and some of the frontline services within the Royal Infirmary. But it's fair to say that pressures still continue in those areas. What we're looking to do as well is to have as part of our financial planning process is to formulate a sort of set of principles that we can take forward in terms of how we manage the allocations of the set aside services. So that's a piece of work that we're starting to look at. But at this point in time, at a Q1 stage, it still is quite early in the year to get a flavour of or a feeling of how things are going to go. But there is an overspend within set aside at this point in time.
Okay,
want to come back on that, Shameen?
No, that's really helpful. I think it's helpful just to keep engaging on the set aside of how we sit and how it affects us in East Lothian. And I just wonder if you could comment on the audit and risk was updating our reserves policy, and I just wondered if you wanted to comment on the kind of timescales for that.
No, well, the timescale is to have that done within the financial year, so that will be done. And there's only 2 more audit and risk committee meetings, so the clock is ticking, if you like. But we'll bring I'll bring a draft policy back to one of those meetings, and we'll have a debate around it.
Okay, thank you.
Mikey, I think it's always fair to say that this report is Q1. We're actually nearly at the end of Q2, so we're halfway through the year, and there will be significant movement and changes. So I think, yes, I mean, this report is to note, but the real financial pressures will be much clearer as we approach the end of Q2. We then get into financial planning for the remainder of the year and into next year. So I think this is a holding position. I think we accept the noting of this paper, but there's a great deal more to do. I asked this of Craig this morning, but I'll ask you as well. The delay in the Scottish budget, I think it's been confirmed as likely to be in middle of January now. What do you think implications of that might be? And I'm sure you've already begun to think that through. So do you want to share your early thoughts on that?
Well, my early thoughts are it just puts a little bit more pressure on us to try and, in terms of time that we have, to A, interpret what comes out of that, and B, put that into our financial planning processes and formulate the implications of that. I know it'll be a tight turnaround, particularly for the council, who will take have to take their financial plan in February to their board or their committee. So it will put a little bit of pressure on us, but I think we've got a stronger working relationship now, and we've got a good collaborative working, and we share information as and when it becomes available. So I'm confident that we'll be able to turn it around, and we should be able to bring a paper to the IJB in March that sets out our budget setting process, and we should have our funding information as well.
Okay. Thanks for that, Mike. Lawrence?
Yeah, I mean, your information might be better than mine, Andrew, but I think we were still hoping it would be December rather than January. But I guess maybe we're splitting hairs, but it's certain that the fundamental position still remains. And we've got pressure we have a legal amount of time to send out notices of a council tax and things, so it is really challenging for us. Fiona and I were talking about this already, about the importance of being clear on the decision-making points from both perspectives and making sure they're aligned, and we've thought that through in advance so conversations can take place. I think the fact that it's pushed back to the right makes that even more important. So I think at officer level we can work that through between us, but that clarity of process for both sides I think will be really important. Thanks
for that. I just thought it useful to raise it whilst it's an issue, and it's good to see that officers are working through the logistics of that. Mike, I'm seeing no more hands up, so happy to note the report. We have reached the end of our agenda, so thank you, colleagues, for your contributions today. Our next meeting is the 30th of October, and then we're into a run of monthly meetings through to year end. So thank you, colleagues, indeed. Have a good rest of the